From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon and welcome to 22 News in Focus. I'm Laura Hutchinson. Last Sunday, we had State Auditor Suzanne Bump on, who talked a lot about her findings after auditing the state's Health and Human Services Department. We talked about everything from homelessness to the opioid crisis and fraud allegations in public assistance programs. That's where 22 News in Focus comes in today. Today, we'll talk to the Secretary of the Office of Health and Human Services. We'll hear about what's being done to make the different departments run more efficiently. We'll hear how the state is responding to the opioid health crisis and what's being done to protect children both in their home and those who are homeless. Here to answer our questions today, we have Marylou Sudders, Secretary of the Office of Health and Human Services. Thank you so much for being here.
Well, thank you for having me.
So you were appointed in January. Let's first start there. How are things going? How do you like your position there first?
Well, it's an awesome responsibility and an unbelievable privilege to return in a paid position to the Commonwealth of Massachusetts. This is my fourth paid return, so obviously I'm a public servant at heart. And in many ways, I think my entire professional career and personal experience has really led me to this incredible opportunity to serve in the Baker administration as secretary.
Now, this is a huge umbrella that we're talking about. DCF is obviously incredibly timely right now. We'll get more into that in just a moment, but also the opioid crisis, homelessness. These are major issues facing our state that we've been talking very closely with, fraud allegations and public assistance. How are you prepared to handle all of the different aspects of this job?
Well, as you say, it is an awesome scope. So essentially you're looking at almost half of state government, a $21 billion secretariat, 22,000 public employees, 15 agencies serving some of our most vulnerable citizens, particularly children, elders, and people with disabilities. As a social worker, I think I'm pretty prepared to deal with complicated issues. I sort of thrive on problem solving. I think that is my training as a social worker. I don't shy away from complicated issues. My first real responsibility was to appoint commissioners across the Secretariat. These are, I hope you have some of them on your show. These are people who know their subjects, and as important, these are people with really strong interpersonal skills, so they'll engage with individuals, with the public, with press, because a lot of it is listening in order to be able to understand what root causes are in order to solve problems.
So as a social worker yourself, you understand our state's kids are the most vulnerable population, and they mean a lot to all of us. And recently, this 7-year-old boy in Hardwick was found burned, and that home had just been visited by a social worker. This comes not long after, of course, the case of Jeremiah Oliver. That boy had also sort of been neglected by a social worker. So talk to me about how we can show that we are protecting our state's kids. DCF is a very important department, and we're seeing circumstances where it's failing some of the kids who need us most.
Well, I would caution all of us to put a little of this horrible tragedy in some perspective. DCF has works with some of the most complicated families in the Commonwealth of Massachusetts and are really charged with making decisions with not a lot of facts available to them. In the case of the 7-year-old from Hardwick, there were lots of eyes on him. So not just the DCF social worker, there were 3 private agencies providing supports not only to the father but to the child, up until a week before he was found unresponsive and 911 was called. So we really need to understand what happened in this situation, one, to prevent it from happening again, or to put the systems or understand what happened, and to really do right by the children of the Commonwealth. So we're doing a full review. I've made a complete commitment that the findings will be made public, because that's part of what we owe the public is, confidence in our Department of Children and Families. We've added, since I joined the administration, we've added more than 300 social workers. Since January, 80% are licensed. This time, well, not this time, last October, about just under 50% were licensed social workers. As a social worker, I have a proud identity about licensure. That, again, that increases the professionalism of the work. Commissioner Spears was a line social worker in the Department of then Social Services many years ago. So we have confidence in her, and we will get to what the root causes of this situation are.
Okay, and I know we can't talk more specifics about that case right now, but it does raise the question of the caseload per social worker, and also if we are having the personal relationship that you would want to have with a social worker and the families. Is there enough of that personal connection there so that there is a caring aspect to this? Do you think that the number of social workers that you've added is going to make an impact in both the caseloads and also the type of relationship that these families have?
So the caseload size is critical in order to ensure that social workers have the most trusting and positive relationship with the families that they're working with. So the caseloads are coming down. They're not to where they need to be. And we are continuing hiring social workers. So the Department of Children and Families is under no hiring cap. So we are in a constant state of hiring social workers in order to continue to bring the caseloads down, which is one critical factor, right? The fewer cases that you have, the more attention line social workers can pay attention to. So that's one very critical factor. So the good news is they're coming down, the caseload sizes are coming down, but we need to stay very vigilant to ensure that social workers have about 15 cases per caseworker, so that they can really pay the attention they need to do. You know, the challenge for the department is, and as it should be, is that we can't put families on wait lists. So, you know, in other services, if you've hit your caseload, you could say, you know, we're going to have people wait for services. We cannot do that because we need to respond in emergency situations. So my commitment is continuing to add social workers, give them the supervision, the clinical supervision they need, and the tools they need, like the iPads, like the cell phones, the other technical skills, so that they can do the very hard, challenging, and rewarding work of being a DCF social worker.
Okay, very good. Secretary Sudders, I'm so happy that you're here. We do have a lot more to get to, so we will take a short break and we'll come back and talk about the opioid crisis. That's something that's also impacting people right here in our backyard in Western Massachusetts. Stay with us. We'll continue our conversation with the Secretary after this. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking to Marylou Sudders, Secretary of the Office of Health and Human Services for Massachusetts. In the last segment, we were discussing what's being done to improve the Department of Children and Families. Another big issue facing Western Massachusetts is the opioid crisis. I know that you chaired the opioid working group for the governor, so I want to hear what is being done now to, you know, we're hearing so many different aspects of this, from waiting lists to just not enough awareness of the issue. So talk to me about what's being done right now.
Sure. So as you know, the governor, right out of the box, appointed an opioid working group to really understand what was happening in the Commonwealth. It was not on his radar screen until he was campaigning, and then everywhere he went, someone would say, talk to him about their son, their daughter, and would always say, we come from a good family. So a couple things. One is, lots of things. Addictions is a medical illness. We need to see it as that. This is not moral failing. This is a disease, and we need to treat it as that. And that will go a long way, I think, to helping to reduce some of the stigma attached. And it can affect anyone. So in Massachusetts, 2.5 times more people die from unintentional overdoses than from car accidents.
Wow.
I mean, this is an epidemic. So we're tackling this across the public health spectrum of prevention, intervention, treatment, and recovery. This is all tools in the toolkit, a multi-phase, multi-year strategy. So to answer your specific question, coming right out of the box, we're adding the governor in a supplemental budget, both in the budget that just passed and in a supplemental, adding about $30 million when all is said and done in new resources on public awareness, right? Reduce the stigma, how do you get treatment, and more important, or as important for families, increasing the access to treatment beds. So detox beds, step-down beds, a whole continuum of care, so individuals can get the treatment across a continuum that they need to recover. In Greenfield, come fall, about 64 new beds will be coming online. We're very excited. Greenfield's been it's just up the river here, so we're feeling very good about that. But really expanding access, because you need, when someone's ready for treatment, you need to get them in treatment. And if they're not ready for treatment, but they are at imminent harm, we need to be able to help someone involuntarily get to treatment.
So there's a lot of focus, obviously, on the recovery end of this, and you did mention the awareness and how we sort of refer to this. You know, it needs to be treated in a certain way. Is there enough attention being focused on where the resources are actually coming from? Many people, begin on medications that might be in their own cabinets. Are we looking at our medical professionals who have access to these medications in hospitals, in their offices, prescriptions? Are we focusing enough attention on how these hard medications are making it onto the street sometimes?
That is a great question. In fact, the working group really focused on opioids and prescribing practices and doctors. So we know that if you start misusing prescription drugs, 40 times greater that you'll become addicted to heroin. Like, who would ever make such a linear path, right, from using Percocets and other kinds of medications to heroin? But we know that that happens. So we're focusing a lot on prescriber practices. We'll be changing some of the requirements for prescribers, physicians, doctors, nurses, PAs, and the like, around continuing education around both the positives and negative effects of opioids. We're changing what many people have said is the clunky prescription monitoring program, which is available for doctors to use to see if somebody is around their prescriptions. So we actually, this summer, about 2 weeks ago, put out an RFP for a new prescription monitoring program to facilitate treatment rather than being an impediment, to increase the compliance. We're focused on we're working with the Mass Medical Society to really target doctors around, again, understanding both the positive and negative uses of medications, and we'll be engaged in public awareness around clean out your medicine cabinet. Open it up, see what's there, get rid of it. So I think you will see a whole series of actions happening around focusing on prescriptions, because we know that the misuse of prescription drugs, about 65%, come from your friends or relatives.
A lot of people don't even know what to do with their prescriptions when they're done. Where do I dump it? I know there are some prescription take-backs. Are we going to be seeing more of those, or, a possibility to have a place to bring your prescriptions when you're done?
So we have a website, and we will send you the website for stopaddictions.gov. That's where we'll be uploading where you can take your prescription medications, mostly to police departments. We'll get rid of them, have drop boxes, and we're looking to pilot with pharmacies drug take-back programs that are free for patients. So we're talking right now, I can't say whom, but a national chain around piloting with us or drug take-back.
Okay, we'll be checking in for that when that does come out. And the Gloucester Police Department, I know, has sort of implemented this program, or they're testing this program, where an addict can actually ask for help if there is a drug issue there. Talk to me about what they're doing, and if there's any consideration for that becoming a statewide implementation.
So the Gloucester Angel program, we really credit the police chief in Gloucester for stepping up and saying, we can't incarcerate our way out of a drug problem. We need to help people get into treatment. So if someone walks into the police department, and even if they have some minor charge, they will redirect them into treatment. It's starting to be, this is where I think what we need to do in the state is to watch local interventions and to see if they're successful, and then help sort of spread them. In fact, Arlington is about to replicate the Gloucester model. So rather than my saying today, yes, every municipality should have this kind of a program, is to point people to Gloucester and say, would this work in Chicopee, Springfield? You know, what works in Gloucester may not be the solution in Springfield.
Police chiefs here can on their own go and do their research and implement it within their own police department if that's something they choose. Secretary, and I know that so many people wind up homeless once you are addicted to drugs and heroin. So let's take a short break, and when we come back we'll talk about how we are tackling the homeless crisis, which is affecting many people in our area as well. So stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. We are continuing our conversation now with Marylou Sudders, Secretary of the Office of Health and Human Services. Thank you again so much for being here. We talked a lot about not only DCF, but also the opioid crisis. I appreciate you talking to us about that. Another issue stemming off of the opioid crisis is that many times will lead to homelessness. Something we've seen a lot of here in Western Mass. We've been looking at people living in hotels, motels, living on the streets. No matter what, it's an expensive problem for the entire state. It's also heartbreaking to see. So talk to me about what you're doing to curb the numbers.
Yep. Great. So ending homelessness, particularly family homelessness, but family homelessness and individual homelessness is a clear priority of this administration. It was one of the reasons I was excited about returning to government. When I was Commissioner of Mental Health, in fact, I worked very hard with the homeless community across the state around helping individuals with serious mental illness not be discharged from hospitals to the streets, but really helping individuals be redirected into transitional housing and then more permanent housing. So this is an area I'm quite comfortable in. It's complicated. Motels are not a place for homeless families to be far away from whatever their natural community is. It's stigmatizing, it's wrong, and it's frankly, it provides a roof, but it's not at all habitable living. I mean, imagine living in one room with a couple of children.
Nowhere to cook.
Far away from whatever natural supports you have. So the governor made it very clear this is a priority. Health and Human Services has been focused on really trying to prevent families from becoming homeless by providing what's called a home-based voucher for individuals. I know it's a little jargony, on emergency assistance to try to prevent them from entering the shelter system.
Right.
And then to work with them to help stabilize whatever their housing situation. And we've seen the numbers start to come down because that's really concentrated effort by state government, local governments, and local providers to really help people who are in the motels and hotels to move out and to help redirect people at the front door from becoming into the shelter system altogether. So this is a really concentrated effort on our part.
So I know that the trends in the past few years have been, as back to school season begins, sometimes those numbers will go up for whatever reason. You know, this diversion program that you're talking about, also the stabilizing on the other end of it, do you think that these are strong enough to keep these numbers going in the direction? Actually, before our taping, I looked at the numbers in Western Mass, and our hotel numbers are down significantly compared to even just 6 months ago. So these are going in the right direction. They seem like, are they strong enough to continue, or do you think that we are going to see that uptick once again come the colder weather? And
so this is one of those times where I believe so strongly in focused leadership, that you have to stay very focused on homelessness and continue to, I hate to use the word chip away, but you continue to help people move out of shelters. You help prevent people from coming into the shelter to begin with by stabilizing them from wherever they live, and you have to really keep your eye on the ball. When I was, again, going back to when I was commissioner, I was very committed to not having individuals leave state hospitals and general hospital psych units into shelters, and by staying really focused, making a commitment, we were able to very much create additional supportive housing for individuals and bring down the number of people with serious mental illnesses in the shelters. So our commitment is very focused attention, and not say, okay, the numbers are going to come down, we're satisfied. We're not going to be satisfied until no one is in a motel in the Commonwealth of Massachusetts.
Now, I've also seen the numbers and know that several hundred people just in the last couple of years have come in from out of state. Is there enough of an effort to help those folks who live in surrounding states to stay where they are, whatever their situation might be? You know, is there a hard look at to what their situation is, and do they need to come here to Massachusetts, and is there anything we can do to help them where they are, you know?
Well, one of the opportunities or challenges of Massachusetts is that we are a right to shelter state.
Sure.
So some people do come in from other states into Massachusetts. The numbers are actually not as high as frankly I was worried about, but we're focused very much right now on folks in Massachusetts to help them come back to their natural communities, get kids back into the schools that they're familiar with, and then we'll be focused on sort of the peripheral states.
And what do you think is next for that right now? Do we see any changes? Is there any additional funding for more vouchers, for more housing? Do we have any new developments coming up to give people more places to live?
So for the FY16 budget, which was just passed, includes about $20 million in rental vouchers and this emergency assistance program that I mentioned, again, to try to divert families from coming in by stabilizing them, as well as rental vouchers for people who are in shelters to come out. You know, there is housing out there. We will contract with specialty providers who are really good at finding and locating housing that meets people's income eligibility. So I'm pretty confident that I can't create housing units overnight.
Why not?
But we can help continue to bring these numbers down.
Very good. Secretary Sudders, thank you so much for being here. You know, you certainly have a lot on your plate, and we covered a lot of issues today. I appreciate you coming on and talking to us. All the best to you.
Thank you. I take all the good luck I can get.
Thank you very much, Secretary Sudders. Thanks for joining us, and we'll have the last word for you after the break. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we had a chance to talk one-on-one with Marylou Sudders, the Secretary of the Office of Health and Human Services. Over the last half hour, we covered a number of different issues, including the opioid epidemic, homelessness, and changes in the works to improve DCF and better protect our kids. That is our program for today. We want to thank Secretary Sudders for joining us. Thanks to you at home for watching. If you've missed any of it, you can watch it in full on our website at wwlp.com. From all of us here at 22 News, we wish you a wonderful Sunday. We'll see you next week. Take care.